Hi, my name is Allison Lewis. I'm going to be demonstrating how to do a nasogastric skill today. I am in the nursing program, the ADN nursing program at FSCJ. The first thing I'm going to do is verify the physician's orders with the MAR and make sure see what kind of tube is needed, see what the purpose of the tube is. And I'm going to gather my supplies. I'm going to have a bucket just in case there's any vomitus that needs to be expelled from the patient, a cup, my tubing, tape, pen light, rubber band, lube, and my syringe and a towel. Once I have all of that, I'm going to walk in the room, introduce myself to the patient, identify the patient by having them identify themselves in two ways: their name, date of birth, and check their wristband. And I am then going to assess the patient's nares for occlusion and patency. Just going to look. And then I'm going to look in the throat, make sure there's a clear pathway. And then the next thing I would do is measure the tubing amount that I need. You start from the tip of the nose to the ear and down to the xiphoid process. And then you would mark that with your tape. Once that's done, I'm just going to set this aside for a second. I'm going to wash my hands. I'm going to put my gloves on. And then once I have done that, I'm going to place a towel on top of the patient. And at this point, I have made sure that the patient is at a level that is comfortable for me to reach. And right now it seems like this is an okay level for me to be at. And I'm going to now put some lubricant, about 4 inches, onto the tube. And lay this over here. I'm going to grab my cup. And to start, I'm going to have the patient tilt their head back, and I'm going to let them know I'm about to begin. I'm going to go ahead and place this into the nares. And once I have started, I'm going to check the back of the throat for tube, any coiling going on. I'm going to have the patient at this point take sips of water. And I'm going to have them tilt their head forward as I continue to place the tube. And if I notice any gagging, I would just slightly pull the tube back out, let them rest for a second, and then continue putting the tube in. And I would make sure the tube goes all the way up until my mark. And then I would take another piece of tape. Now, and I would just tape it off to the side to their cheek. And then I'm going to check the placement. So I'm going to, first of all, ask them if they can talk. And another way to verify placement is to have an x-ray done, a chest x-ray done. I can also use my pen light and I can check the back of their throat and make sure there's no coiling, which is important. I can also check for the pH. So you would draw a little bit for the pH, and you can also listen as you re-inject over the epigastric region for the swishing sound. Okay. I'm going to do that. Now I'm going to attach the rubber band onto the tube. And then safety pin that to the patient, as well as, just gonna lay that there, as well as remove this tape and take another piece of tape and anchor it to the nose. then put another piece of tape. It would probably look prettier than that in real life. Put another piece of tape over that. And then I'm going to attach it to the section at whatever rate it's ordered at. And let's go ahead and fix this to reattach my, just to get a better visual. I think that probably is better. And so once I have attached it to this section, I'm going to document the date and time of my procedure, the contents that came back, any drainage, as well as the type and the time, and my initials, of course. And after I have documented everything, I'm going to go away, clean up, and then go away, and I'll come back to check the irrigation. So once I do that, I'll come back in, I'll detach it from the section, and I'll lay it right here. And I'm going to take my syringe, and first you want to aspirate your contents and check for placement by listening when you re-inject. In the epigastric, and you want to hear that swishing sound. So once you hear that, you can verify the placement, and you can go ahead and withdraw 30 mLs of your sterile water and inject that into the tube, and then withdraw another 30 mLs of contents, and reattach that to section if needed, and discard this. And then you would document your irrigation process, the time, date, any contents that the consistency, the looks of the contents, the density compared to the beginning volume, any issues that you may have had with your irrigation process and how the patient handled that process.